All the very best to all the 4 teams. I would like to introduce our Dance Gujarat coordinators, Dr. Amit Gupta and Dr. Jagat Patel. Now we'll start with the quiz. Who is the quiz master? Do you all know? I like to introduce him, but he really doesn't need any introduction though. Okay. He is our quiz master for today. He is a very well-known radiologist, AIMS PGI AIPG topper, eminent and innovative educationist. He is a very unique blend of academic excellence and entrepreneurship. Dance director, Dr. Subair Sethi. Please come on the stage.
Thank you so much for the kind words, and I'm sure we should be able to do a good, interesting quiz today. And I'm very happy to see the home team here. Home team, yes, I can see the pressure on their face because अभी बाकी लोग हारेंगे तो किसी को पता नहीं चलेगा. ये हारे तो पता चलेगा ना. But लेकिन ऐसा नहीं है, बाकी एकदम रिलैक्स हो गए. But let's see. मैंने क्या किया कि I've tried to put up a quiz जिसमें I have added a few questions which are entertaining. I have added a few questions which have been asked in the recent exams, and some of them have been asked in the exams like AIMS, JUPMER. Some of them are very tough, some of them are very easy, and I have created a good number of rounds, and I have created a good number of audience questions. But before I start with the quiz for the day, I would like to thank Dr. Amit and Dr. Jagat for taking this unique endeavor to make sure that the learning remains fun for you. And that is what we actually believe in DAMS is that medical education is an art and medicine is in itself an art. And we have to make sure that you guys enjoy it. ऐसा ना होना कि पढ़ना तुम्हारे लिए दर्द बन जाए, मतलब it should be fun. So we'll try to make it fun. But in the end of the class, in the end of the quiz, even if you're sitting as an audience, you will take home at least 5-6 questions for your exam that you will be appearing for. Any exam that you will be appearing, you will get 5-6 questions from what we will be discussing today. So that is my entire endeavor, and it would be interesting, but it would be yielding as well for any exam that you appear for. And talk about in between that what pattern I am trying to follow now. I would also like to credit here, although they are not today with us here, but I would like to credit Dr. Sachin Arora. I don't know if these guys would recall the person who actually hosted the preliminary rounds. And Dr. Sachin, he actually hosted the preliminary rounds in each zone, and that is where we have selected the finalists. So he has done a lot of hard work in this, and I'd like to mention Dr. Rahul Raji, who helped me in creating this episode of the quiz. And let us see, let's hope for the best. I am a radiologist by profession, and I'm a very, very fond quizzer. In my own time, when I have actually won almost all quizzes that I participated as an undergraduate, then as a postgraduate. And I have hosted many quizzes in the past. I think quiz is something which comes very close to a competitive exam, competition life. So when you start quizzing, you are here to win. Yes? So let's start with the round one. Give me just 1 second to get it organized. And Arjun is again, very tense because he's trying to take the quiz online. Let's try our best. Okay. If it doesn't go live, I'll make sure that the recorded version goes, and we should be able to showcase the beautiful auditorium that you have. I've taken my lectures in all auditorium. This is one of the best auditorium that I have seen. I think your college deserves a big hand. One of the best auditoriums. And I feel, I've interacted with a lot of audience. I already have a feeling that you're one of the best audience already. So only the boys actually are happy to hear this. No applause from the girls at all. Oh yes, she's one dynamic lady there. Yes. Okay. So let's start with the quiz here. Are we game for it? Okay. So the last minute Murphy's law is working on. Just give me 1 second to solve the Murphy's law. Perfect. Okay. Too early. By the time we get the thing going, I'm sure you can see this is the AIMS mid-year result of dance, and we have this time we have created a record with all 10 students are dance students. This is a new record and you can actually see one of the Gujarat boy in the 10th rank. You can see he's one of our dance Hyderabad student who got a 10th rank, Kautilya Patel. I think most of you would have heard of him. He's already a celebrity. So I think he deserves a big hand from the entire team. So it is actually possible for everybody to think and believe that you can reach to the topmost institutes if you actually work hard. Okay, by the time we actually get this started, how many of you are actually in second prof? Second prof, third minor, third junior final, senior final, interns, post interns. Okay. Now first year, okay. No, none of them. So every time in a lecture or any event, if I say first year, so second year, third year वाले लड़के तो थोड़ा हंस देते हैं. आया कैसे फर्स्ट ईयर जैसे होता है कोई ना कोई फर्स्ट ईयर यू नेवर नो every passing year I see that people are getting more and more competitive. First year they are part of competitions and they even win. So let us see if we can get the visuals back. I see another cable dropping down from the first floor, so I'm sure we should be able to do the live from that. Now, give me this once. This. By the time we actually get the quiz going, let me have a question for the audience, and I ask Dr. Amit to help us with the audience praise, so that by the time we get the quiz, we can have a question for the audience. Can you name the part of the diencephalon from which pineal gland develops? What do we call that? What do we call pineal is a part of what? Part of the diencephalon. Anybody who wants to answer and winner to answer to award can actually raise your hand and answer. Pineal is a part of which part of the diencephalon? Anybody? What do we say pineal? Pineal is what? Pineal is part of what? Anybody? Anybody? Okay. No winners for this? Okay, let's see. And okay, second question, let's see if we can answer. Can you name what is the most common tumor which occurs in the pineal gland? Most common tumor which is seen in the pineal gland. Most common tumor, I want to know the histology. You can actually win some book or a pen drive or so many prizes to win. You can go home richer if you actually answer this. Any most common tumor of the pineal gland is I think he has answered. Glioma. Unfortunately, I cannot give you anything. Any answer? Anybody else has an answer? What is the most common tumor of the pineal gland? Anybody? Yes, he wants to give an answer. Huh? Metastasis. Incorrect. Pineal is not a very common site of metastasis. That would be the next question then. We will ask the next question after this. Yeah. Anybody? Yeah. Okay. Anybody wants to answer? No, for you, you will get your chances. No problem. Okay. This is just for the audience. You don't keep them interested when the projector comes back. Yes. So, what do you think is the most common tumor of the pineal gland? It is not glioma, it is not metastasis. She wants to answer. Did you Google it by now? She says germinoma, which is germs if you are correct, and she wins a prize. Yes. Congratulations. So most common tumor of pineal gland is actually a germ cell origin tumor called as germinoma. Now I'll add a question now because of what he has answered. Let us see if you can answer. What is the most common site of cerebral metastasis? What is the most common site of cerebral metastasis? He said pineal, he answered metastasis. I said metastasis, pineal is not a typical location. So what is the most common site for cerebral metastasis? Anybody wants to win a prize can answer. And the prize is valid till the time we will be, valid till the time we get the projector back. So quickly answer. What is the most common site for cerebral metastasis? And this is the previous question that has been asked in the exam as well. Anybody? Anybody? So the answer to the previous question, pineal is a part of epithalamus. Epithalamus was the answer that I was looking for. And can you now tell me what is the most common site of cerebral metastasis? Cerebral metastasis. Anybody knows? Anybody knows? Okay. So should I give you the answer, or it is the junction of grey and white matter? Grey-white matter junction is the most common site where you see cerebral metastasis. And I think we have the projector back. Yes. And with their kindness and the bluish background in the screen, let me say, this is me with the rank 1 AIMS this year and the rank 1 PGI this year. And if I take you forward, this is rank 1 NEET. This girl, Dr. Shabnam, she's a Trivandrum Dam student, and the reason I am putting her picture up is just to let you know, she was a rank 17,000 in her first attempt, 17,000. And she worked hard for one year. And that is very beautiful to actually understand that many people would say that, if you get a rank 17,000, you would not tell her that you will get a rank 1 next time. You understand? Usually we feel that rank 1 तो कोई ऐसा होगा ना जो बचपन से ही rank 1 वाला होगा. You understand? And she was a rank 17,000. She put in 1 year of hard work. उसने interview में YouTube पे डाला. If you look at her interview, बहुत कुछ सीखने को मिलेगा. वो कहती है कि मुझे average student थी, लेकिन मैंने एक साल में हर दिन 15 घंटे पढ़ा. हर दिन 15 घंटे पढ़ा. She's rank 1 this year in NEET PG. Very awesome result she has. And this is the rank 1 the year before. We've been doing it for last 2 decades. This is one of our sessions that we do in Delhi. This is Nagpur session. This is called as DVT. And in this, what we do is we discuss the new pattern questions. And this is, if you see on the corner, you will see me and you will see pancreatitis on the image. And we are trying to teach to the entire crowd. This is DAMS DVT session. So guys, let me welcome you to the quiz session now with all due awards. In between there will be audience quiz, and we'll start with the theme A, B, C, D. I'll keep telling the rules in the way. So the theme is, we'll try to make a movie together. I have tried to create a movie. In between every round we'll be doing something about the movie, and the goal is to make learning fun, and the goal is to make a movie together. So this is the theme of the quiz, is NAMS medical movie, and let me take you to the preliminaries. This quiz will have 14 quick rounds, Rules for each round will be mentioned along with each round. My decision will be final. Okay? I just wanted to make you know. And the second thing I want you to know is that if you prompt for any question, I will deduct marks for the whole team. Okay? Even if you prompt for them, I will deduct the marks for the whole team. So I am sure you will not prompt by after this. Correct? So they have many friends and they are actually very nervous. So I want to wish all the 4 teams best of luck, and I hope and I sincerely hope the best team should win. Okay, that's it. So let's start. The round 1. In the round 1, we will talk about credits. I'll explain what the meaning is. So that whenever we study medicine, we have to start by paying credit to the people who actually discovered something. And I show them a picture. They have to identify the person. If they answer it without the hint, there will be 10 marks. They can ask for a hint, then 5 marks. If they pass, then 5 marks for the pass. There is no negative marking if they answer wrongly. But please don't prompt. Okay, I'll show them a great person in medicine, person who is historically very significant. They have to identify with the picture, 10 marks. If you don't identify, you can ask for a hint, then 5 marks. If you identify or pass, 5 marks. That's it. So we start with the team A. Team A. And I always want you to know, history has, always something interesting in it. Let's talk about this. Team A. Identify the man in the picture. Team A. Identify the man in the picture. The time starts now. Do you want to answer or you want to follow?
Sir, Robert Koch.
He says Robert Koch. Do you agree? Yes, correct. 10 marks. So he is the founder of modern bacteriology. He is known for his works on anthrax and tuberculosis. Very famous. This was a hint. If you had taken the hint, you would have lost marks, but you actually got it correct. It's Robert Koch. Very good. The home team is off the mark. Team B. Pressure building on you now. Team B. Look at the screen for your direct question. If you answer without the clue, you will get 10 marks. With the hints, 5 marks. Everybody on your tips. Identify the man in the picture, and the beautiful thing is this same image has been asked in your central exam. Okay? Let's see. Identify the man in the picture. Famous man. He's not James Bond. Okay. He's not from Gujarat, is it? Anybody? Yes. Team. He wants a hint. So he's already lost 5 marks. He wants a hint. He is the man who popularized the concept of the magic bullet. That is what we have put foundation for further pharmaceutical research. He received Nobel Prize in the year 1908 for his contribution to immunology. That is the clue. Team B, what do you think? Hoffman, incorrect. Pass to Team C. Yes.
Alexander Fleming.
Alexander Fleming. Incorrect. I wish I could take service on marks. Team D. Team D. Okay? No, they don't want to play. Team A.
Paul Ehrlich.
Team A says Paul Ehrlich. What do you think? Audience? Correct. Again, for 5 more seconds. And the audience explodes. Very good. So he is the man who is actually known as the father of immunology as well. So that was a very big clue there in the choices, but they could not take. Team C. Are you ready for your direct question now? Team C, ready? Okay, I can hear you. Okay, very good. So Alexander Fleming, no. Don't guess at this, okay? The audience is looking at you, okay? Serious. Okay. Identify the man in the picture. Okay, no problem, please.
William Bronson.
William Bronson. Very good. What did he do?
Discovery of X-rays.
Correct. He is the man who is known as father of X-rays. He discovered X-rays in the year 1895. William Bronson. Which country did he belong to? They get full 10 marks. Which country did he belong to? Anybody knows? For our audience, no prize. Okay. Germany, very good. Okay. And this was even asked in the last already exam that it is like, which year was the X-ray discovered? 1895. 1895 is the year. Now, very, very important. He is the father of radiology. He received Nobel Prize for Physics in the year 1901. Okay. Team D, ready for your direct question? Okay. Everybody, on your screen. Identify the man in the picture. Team D. Okay. I know. When you are in the audience, you always get more voices with the participants. Okay. Is this pastor? Is it good pastor? Incorrect. Pass to team A. They want a hint. They want a hint. Okay? Very smartly, the home team is playing. Father of antiseptic surgery. He was first to introduce carbolic acid to sterilize surgical instruments and keyboards. This is big hint.
Joseph Lister.
This is Joseph Lister. Correct. They get 4-5 answers again. Yes. Now what I'll do is, I think we're done with the teams. I'll give a question to the audience. Okay, I think that you deserve it now. You've been so kind. So let me give you a direct question from the audience. This will bring you a pen drive, I think. Pen drive. Okay, pen drive question. Identify the man in the picture. The reason I am getting this man here is that he deserves credit. But unfortunately, although he's an Indian, many of you would not know it. Some of you might know it. He deserves credit, yes. Yes, he also awesome. Sit down, man. Okay. Thank you so much for standing. Anybody wants to? He deserves credit, and that is the unfortunate thing that he's a man of Indian origin. He did huge amount of research, and he is credited for so many discoveries. But unfortunately, the kind of people we know, some German लोग पता है हमें Indian नहीं पता. We have to tell them. Can anybody tell them? That's why I bought this for our audience. Because I want to make sure that he reaches you. And as youngsters, you should know that Indians have done good work. Yes. Hint. Okay, let me give you a hint. He's the Indian biochemist who worked in US. He discovered ATP. He discovered methotrexate. And unfortunately, India was not aware of him. He was denied Nobel Prize. He deserved it, but he was not given. Anybody knows? Anybody? So can you understand that हमने बहुत अच्छा काम किया है इंडियन लोग बहुत होशियार हैं उस क्रेडिट ही नहीं मिलता है ना अब बताओ anybody so he is Dr. Yelaprada Subbarao and a fungus Supromyces is also named after him, but there is a saying, a person who was writing his biography is actually written that he lived so that other people could live. He never took so much credit. Now was not very famous as well, but can you imagine ATP, methotrexate? This is the guy who did it. Okay, Indian origin. So keep this in mind, very, very important. So we are at the end of round 1. Let us start with the next round. Next round is in the movie, continuing with the movie theme, is we want to see when hero meets villain. That means in this round you will have a film personality who has a disease. And I want to know the disease from the participants. Okay? You understand my question? Not the film star. Okay? Don't tell me the film star. Okay? I want to know the villain. Okay? Ready, everybody? Don't prompt, but okay? And don't whistle if you see the star on the screen. You have to identify the disease. 10 marks for the correct answer. Question can be passed. 5 marks for answering on the past question. There is no negative marking in this round. Okay? Clear? Team A. Team A. The home team. Identify the disease this man is suffering from. Okay, some of you are a fan of him, I know.
Trigeminal neuralgia.
This is trigeminal neuralgia, correct, 10 marks. This is Rajnikant. No? Who is he? Salman Khan. Salman Khan, very good, I'm sure. Some of the girls were actually, disliking that I am not recognizing him. Okay, Team B, ready for your direct question. Team B, ready for your direct question. You have to tell me the disease this famous film star is suffering from. Whistles, please. What do you think? They were always studying, they never actually saw her on TV. Team B. He says, tell us if I have to pass it to Team C. Go back and Google her. Okay, Team C. Team C, pass question to you. Do you even know her? Team D. Team D.
Legal skills, sir.
Particular doctor, I want to give him something, but I can't give him. Okay, no, I will not. That's zero pass. Team A, finally pass to you. Team A. Who is she? Who is she? Team A. They don't want to play it at all. Anybody from the audience, do you know her? Lisa Reyes. What is she suffering from? Multiple myeloma. Who said? I think you already won an award, but not giving it to you. So this is Lisa Reyes. Go back and Google her, you might enjoy it as well. Team C. Team C. Direct question for you. Team C. Look at the image. Look at the screen. What is the disease this famous film personality is suffering from? Let me try to warm you up to BC case quizzing after this. Team C. They don't know her. Okay. She's Indira Gandhi. No, they don't know her. Don't worry. At my age, everybody would know her. You know, but at your age, maybe you know, you forgot her. If they want to pass it. Okay. Team D. Team D, pass to you. Team A. B. There's no negative marking. You can say any disease. Syphilis. No. Okay, let me pass it to the audience. None of them know it. I hope you know she's Manisha Koraila. Now, is she suffering from something? Is she suffering from something? Anybody wants to answer? Yes. The girl with you. Yes, please. Huh? Okay, yes, he gets a prize. Very good. He gets a prize. Very good. And actually, I would recommend to you, she has done a TED talk recently and telling, if you listen to her talk, it is going to move you. She's talked about how she started with the ups in her life and then she was diagnosed with malignancy and how she managed the up and down in life. Beautiful TED talks that she's done. You should actually listen to it if you get time. Direct question for Team D. Okay? The hero meets villain. I want to know the villain on this hero's life. Team D. Is he right? Yes, correct. This is Amitabh Bachchan and he has actually had myasthenia gravis. He's even gotten his thymus removed for myasthenia gravis. It's very, very important. Maybe you may not know. And the reason I put up this round is that some of you, when we are kids, हमें ऐसा लगता है जब हम आपकी उम्र में होते हैं कि जो बड़े अच्छा काम कर रहे हैं उनको कोई परेशानी नहीं है। You understand? स्टूडेंट बोला कि सर मेरा तो भी ब्रेकअप हुआ मैं पढ़ नहीं पा रहा। अभी देखते कि इतना फेमस लोगों को क्या क्या हुआ फिर भी वो अभी आगे काम कर देखा नहीं वो सलमान खान को देखा नहीं देखा एक्चुअली देखा जरूर अपनी myasthenia gravis and even if you say thalassemia minor he also has thalassemia minor very important okay now let us go down to the next round is the Pehलवान round okay because in every movie there has to be a Pehlवान means somebody who is muscular. That means in this round I am going to talk about muscles, okay? And they have to identify the muscles, okay? Let's see. In this round, 10 marks on the correct answer, 5 marks on asking past question, no negative marking. Team A, you will get a direct question from me now. Identify the muscle marked. Team A, no prompting, please. You'll get your own questions. Team A.
Rhomboideus major.
This is rhomboideus major. What do you think, audience? Correct. This is rhomboideus major, and I actually marked how from the spinous process to the medial border of scapula you can see rhomboideus major, rhomboideus minor. This is the new pattern of exam. I also wanted to bring it to you that today in the new pattern NEET exam there are many visuals to be asked, and they actually have anatomy in visuals instead of asking in theory. They ask visual questions. This is rhomboideus major. Next. Okay, Team D. Direct question for you, Team D. Identify the muscle highlighted in this picture. Team B. What do you think? Team B. Okay, your Team B is looking at the image. This is not Lisa any longer. Okay, look, slow, faster. Okay. Should I pass? He's very softly saying levator scapulae and he is correct. Could you look at the muscle now? This is levator scapulae and this is how, if you look at the muscle actually, how it is arising from the transverse process of the C1 to C4 and attached to the superior angle and the action is elevating the scapula. So that's why we say levator scapulae. They get full 10 marks. Correct. Team C. Team C. Are you ready now? Direct question for you. Identify the muscle that is shown to you. Okay. This is the new pattern in the exam that they go very visual into questions. Last week exam they had 50-60 question visuals. Popliteus. Sir? Popliteus. Incorrect. Okay. Team D. Pronator teres. Incorrect. Team A.
Antonius.
Team A say Antonius, correct. 5 marks again for them. Antonius. I think you mistook the joint. I'm so sorry, but this is clearly radius and ulna. I thought you do better in this than this. Okay. So direct question for team D. Direct question for team D for 10 marks. Team D. Okay, this was the answer to the previous question. Identify the muscle highlighted for you. Pronator quadratus. Correct. Full 10 marks. So I hope now you understand that there is a muscle called as pronator quadratus, pronator teres. And let me use this marker here for this is pronator teres superiorly. And this is pronator quadratus in the like this. When I prone, I move my hand to the prone. This is pronator quadratus. Correct? You got it correct. Very good. Let's see if we have an audience question with us. We have an audience question. Identify the muscle and the nerve supply. Okay. First one is muscle and the nerve supply. Audience prizes to be won. Audience, what do you think? This is hand. Yes, very good. Now, what muscle is this? Yes, push-up. Yes. Opponent's versus. Okay, no, sorry, thank you. Yes, please. Adapter. Pause. Yes. And I wanted to know nerve supply to win a prize. Nerve supply. Yeah, very good. But which branch of other nerve? What do you say that a deep superficial again? Deep branch. Very good. So this is adductor pollicis. She wins a prize. The nerve supply is deep branch of ulnar. And this has actually been asked in the exam before. What is the nerve supply of adductor pollicis? A superficial branch or the deep branch of the ulnar. One says deep branch of ulnar. Very good. Okay. Very good. Okay. This was the audience. Now let's go forward. In the next round, you will have a skeleton round. That means bones. The questions will be based on osteology. Okay? Again, the rules of this round will be, we will now reverse the order because the home team is getting it very easy, so the other teams might complain. So we'll reverse it. We'll go from D to A now. 10 marks for the correct answer. In this round, I have kept a negative mark. So please note the scorers. If they get it wrong, they will get -5. सही बताएंगे तो 10, गलत तो -5. कुछ भी नहीं बताएंगे तो कुछ मिलेगा भी नहीं, कुछ छीनेंगे भी नहीं. Okay? Team D, are you ready? Are you ready? Yes. Which muscle among the following is inserted to the bony prominence shown in the figure? There's a bony prominence. You have to tell me, I've given you choices, which of them is inserted on this bony prominence? Team D. They're talking about themselves and they're thinking, what will be Galat to -5, okay? So, should I start counting? Anything you want to say? 5, 4, 3. Okay, pass. Team C. Team C.
psoas major.
Psoas major, incorrect. -5. Okay, Team B. Team B. Huh? Okay, I'll hold on before I let them give their answer also, otherwise they will get it very easy. Team A, what do you want to say? Any answer you want to say? They want to say piriformis. So -5 for the team B and +5 for the team A. It is piriformis, which is inserted to the apex of the retrocantine. Okay, those piriformis was the answer. So the two teams have actually got negative marking here. Okay, be careful in this round. There is a negative marking in this round. Team C, direct question for you. Which muscle originates from the bony prominence shown in the picture highlighted by the red box? Okay, and I've given you choices: sartorius, vastus intermedius, vastus lateralis, rectus femoris. What do you think? Screen.
Rectus femoris.
They say rectus femoris. What part is this?
Posterior inferior iliac.
This is anterior inferior iliac spine, but your answer is correct. I give it to you. Full 10 marks. Full 10 marks. Very good. Or maybe you guess somehow. Very good. Okay. I don't mind. Team B. Direct question from the bones for you. What is the vertebral level of the part circled in the red? This is the part. I want to know what vertebral level corresponds to this. Team B, direct question for you. Very direct. This is some move on. I don't know if you know it or not. This is the part which is circled. You need to tell me the vertebral level. TP. T5. You want to say minus 5. Okay, what do you say? Minus 5.
T7.
T7. 5 marks. 5 marks to team A. So what was that? That was inferior angle of the scapula, which is T7. In the future exams, they will ask you a question. Superior angle of the scapula lies at the level of T2. Root of the scapular spine is opposite the spinous process T3. These are potential questions that you will get in your exams. Very, very important to remember. Okay? Now the direct question for team A. Okay? Very important question. This is the previous NEET exam question. Let's see if you can answer. Ligament highlighted in the green represents the degenerated tendon of which muscle? Team A. Direct question for you. Slightly tough. They say this is tibial collateral ligament, which is believed to be a degenerated tendon of adductor magnus. Do you agree? Yes, correct. Full 10 marks for that. Very good, awesome. So this is the level of the real central exams today. They ask you to identify as well as to answer a embryological question on the basis of the image. Okay? So we all know today that the tibial collateral ligament represents the degenerated part of the adductor magnus tendon. Okay? Let's see if we have, in this round we don't have an audience question here. Let's see if we can answer here. Next round, because we're making a movie, we'll get the camera rolling. Now can you tell me what is the camera in our body? So this will be questions based on ophthalmology. Because I feel, because I asked you, many of you could actually tell me that your ophthalmology is your prof. Let's see if you can answer. Rules for this round, reverse order. You start with T, go to A. One question per T, 10 marks for correct answer, no negative marking, 5 marks if you answer the pass. There is no negative marking here. Okay? If all teams are not able to answer, I will take it to the audience. Okay? Let's see. Team D, direct question for you. Direct question for you, Team D. A 40-year-old female is on long-term treatment for rheumatoid arthritis. Fundus is shown to you. See the image below, and I want to know the most probable drug which is responsible for it. You understand? Integration of MCQs. I don't want you to tell me what is the fundus showing. I want to know the drug. I want to know the drug which has caused, and she is suffering from rheumatoid arthritis is the clue. Team D. Okay, very important question. Very important. Very often asked in our exams. Very, very often asked. Team D. Okay. Incorrect. I pass it to Team C. Team C. They are discussing amongst themselves with some papers and the clients of the Team C. Incorrect. Methotrexate. Incorrect. Team B. Tetracycline. Incorrect. Team A. Chloroquine. Chloroquine. I will not give them the answer here. It's not chloroquine. Okay. Now, anybody from the audience now? Hydroxychloroquine is the correct answer. They missed it by an age. You remember, chloroquine is the malaria drug. Here we are talking about rheumatoid arthritis. And what are we showing here? What is this? Anybody knows? What is this? Bullseye maculopathy. Hydroxychloroquine was the answer, and the boy in the t-shirt will get a prize. Audience. Our team for the audience prize will be soon giving you our audience prize. Yes. He gets a last look pathology from NAMS publications, if I can see it correctly. Congratulations. Okay, and this is what happens in the real exam also. You miss out by small inches. Okay. Now the next question. Next question is a direct question to Team C. Read the question carefully. Given below is the fundus finding of a systemic disease. What is the most common organ involved in this disease is my question. I want to know the most common organ which is involved by this disease, not the identification. So I hope you understand this is a multi-step MCQ. First you need to identify, then you want to the most common organ. Team C, what do you think?
Kidney.
Kidney. Incorrect. Okay, Team D. Team D say pass. Okay, pass. Okay, Team A. They also say pass. Team D, any answers? Team D, any answers? Wake up. Okay, no, they don't want to answer. Audience, what do you think is this fundus showing? Very typical finding. What is this?
What is this? This is? No. Anybody wants to answer? This is not correct. What is that? Candle. Any idea? What are we looking at? Sarcoidosis. This is candle wax dripping. And the most common organ involved in sarcoidosis would be lungs. So this was the answer that I was looking for. None of them could tell me. This is a very typical appearance of ocular sarcoidosis. Clear? Understand? Do you understand now how visuals make the matter more interesting? You might know what you never seen. So that is where the exams today have taken the lead. Okay, direct question for team B. Okay, I want to know what ophthalmological imaging technique is shown in the image below. I want to know the technique which is shown below. Team B, direct question for you. OCT. Can you give me the full form for this? I'll give you the marks, but just for these fun sake. Can you tell me the full form? No. So they get full marks. They get full marks. They mark. I identified it correctly. And this is actually optical coherence tomography. This is an image, non-invasive test by which you can take a cross-sectional section of the retina, and it is used for macular pathologies to monitor the progression of disease, see the response to treatment, and it is also used for analysis of retinal nerve fiber layer thickness. Okay? Let's see. Team A, direct question for you. Team A, direct question for you. 25-year-old male presented with decreased vision in the right eye. Fluorescein angiography is the investigation. What is your diagnosis? Not defining. Diagnosis in this fluorescein angiography. Okay, audience, keep ready. I think it might come to you. Team A. What do you think is the diagnosis based on the fluorescein angiography that I am showing you? What is your diagnosis? Team A. Anybody? Team A. Should I pass it? They say pass. Team D. Pass. Team B. Team C. Any guesses? Team B. This is central serous retinopathy, and they get 5 marks for this. Correct. Very good. How many they woken up? So what is this appearance that I am showing to you? What is this appearance? This is the smokestack appearance that you see here. This is typical of central serous retinopathy. Very, very important question. Now once you have this, let us see if we have something for the audience or we don't have it here. So I'll ask the score team to, if they can give me a score already, or should I ask you after the next round? After the next round. This next round is very interesting. Do you know whom you see in the picture? So what does he do? What does he do normally? Diagnose. He can diagnose on the basis of the links provided. This is the theme of this movie round here. I'll give them some clues. There will be multiple pictures on the screen. They have to connect those pictures and give us single diagnosis would be our theme. Okay. Rules for the round. You have to identify the organism using the connecting link. Okay. 1 question per team, 10 marks for the correct answer, 5 marks for answering the past answer. No negative marking in this round. No negative marking in this round. Okay. Everybody clear? Okay. Now, team A. Look at the images provided and you need to tell me the causative organism. Very simple. Team A. Okay, connect the dots and tell me, become the house MD and tell me the final organism.
So the organism is Trypanosoma cruzi.
He says Trypanosoma cruzi. Correct. And what is this? Romanas. Very good. You can see this is how the organism, the parasite is leading to secondary achalasia, that was the variant for our image, and it's swelling of the eyelids, leading to conjunctival, but the parasite enters to the conjunctival. This is Romanas. Correct. You get 10 marks. Very good. So I think so far the team A to me looks leading even without looking at the score. But team B, ready for your direct question now. Team B, put the images together and tell me the causative organism based on 3 clues that you have in front of you. It's very simple. Patient comes to the ENT OPD, ophthalmology OPD, goes to the microscopy, and you get this. Anybody? Team B. Team B says the organism is passed, so I have to pass it. Team C. This was very simple, straightforward. Team C. Rhinosporidium. Team C says Rhinosporidium, Fluidium. What is it? Correct. 5 marks. Very good. So this was Rhinosporidiasis, and the histopathology was actually showing us sporangium, which was in fact its sporoblast. Let me actually go back to the image to show you this. These are the sporoblasts. Okay. Team C got it correct. 5 marks. Okay. Team C, now ready for your direct question, Team C? Ready for your direct question? Okay. There is a clue in the peripheral sphere here, a clue here. You need to put them together and tell me the causative organism. Are you able to follow my point? You can't get it, because you didn't win to reach here. Then one, you reach your rounds to reach here. Okay, so we have to give them the first test. Team C. Team C. I want to know the causative organism. There's a clue here. On your marks. Should I pass it? I don't know what you're saying. Pass to the next team. Incorrect. Team D. Pass. They say it is pass. Team A.
The organism is Babesia and we see the Maltese cross pattern.
They get it absolutely correct. Full 5 marks. Babesia. And the clue was Maltese cross. And this is again a very frequently asked question in the exam. Maltese cross appearance is seen. And if you could see, there was a parasite inside the RBC. It was the RBC where you had a parasite. And you can see this Maltese cross is symbol associated with the kings of the Maltese island. And that is why we call it Maltese cross appearance. But maybe you do not know it. Let's see. The question was very straightforward. Direct question for Team D. There is a clue and a picture. You need to put them together and tell me the organism. Team D.
Anthrax.
Organism and disease. And any difference between them?
Bacillus anthrax.
I think I'll give it to them. 10 marks. This Bacillus anthracis. And this was in bamboo-like appearance typically. That's why the clue was bamboo. And can you see how they look linear, gram positive to bacilli in a really long chains like bamboo? That was the clue. You understand? And when I ask organism, I need to do the organism. I'm giving it to you. Next time I'm not giving it to you. 10 marks I'm giving it to you. Okay? With this, we come to the end of this round, and the next round is for the police investigation. Okay, next, which subject do you think the next question will be on? Forensic. Okay? By the end of this round, do we have some rough scores? 88 marks for Team A. 80 marks for Team A. Home team. B is at 15, 20, 30, 20. So it looks very interesting, but I want to remind everybody that it says 14 rounds, so things might change. Okay. So this is an investigation round. The questions will be based on forensic medicine. They will be asked from D to A, D team to A team. 10 marks for the correct, 5 for incorrect. Minus 5 will be there if there is a negative marking in this round. Plus 10, minus 5. Okay? Team D, are you ready for your questions now? Team D. Ready? Don't frown, please. A case of suspected homicide comes to your doctor. He is supposed to inform the police under what section of CRPC? I want to know the section.
39.
He says 39. What do you think? Correct? You get full 10 marks. Correct? Very good. So I think he must be very strong. There was very strong in forensic. Yes, very good. The question was very tough. I did not think they would do that. Very good. Okay? 10 marks. Very good. Team C, direct question for you. Team C, direct question. Ashley's rule is for determination of age, sex, height, ethnicity. You need to tell me what is the answer. Team C, classic question, very often asked in the exams. Ashley's rule. Don't forget the negative marking. In the real exam also you have negative marking. Team C, ready? You got scared. Okay, pass to Team B. Team B. Ashley's rule is for determination of what? Forensic question, classically every time asked in your exams. They say pass again. Team A.
6. C.
This is sex. What do you think? Correct. And before I actually show you the answer, what body part are we measuring audience in this? You have already won a prize. Let's ask you this, please. You can introduce yourself to the people so that anyone wants to take a friendly question. Sternum size, correct. He gets the audience prize, correct. So this is Ashley's rule. Very, very important in forensic. That if you, this is also called as 149 rule. They say that the male sternum is more than 149 millimeter, while the female sternum is less than 149 millimeter. That is Ashley's rule. Okay? Let's see. Let's go on to the next one. Team A, who did a very good job here. Let's see. Team B, a direct question for you, Team B. Boiled lobster syndrome is seen in poisoning with. These are your choices. This is the syndrome. I want to know the cause. Team B. Boric acid, they say. Correct, they get full 10 marks. It is boric acid poisoning, and the symptoms are erythema, desquamation, exfoliation. It looks, the skin of the patient looks like a boiled lobster. Correct, they get full 10 marks. Very good. Team A. So this forensic, I tried to make it a little tough, but these guys are good. Team A. A doctor or a nurse disclosing the identity of a rape victim is punishable under what section of IPC? Patience. Pass. They say pass. Team D.
Section A. Answer is A.
Answer is A. Team D is getting it correct again. Full 5 marks. They're good at forensic. Maybe studied all these very good answers. This was a little tough round that I created, but I wanted to bring to the audience a message that in the real exam there is always a question asking a CRPC or IPC, which you ignore when you are in medical school, and they are asked as MCQs. So that was the basic message that I wanted you to have. In the next round, because we are making a movie, we will now sit in the balcony and we'll talk about organ in the balcony seat. Which organ is in our balcony? Balcony is the topmost. What is the organ? Brain. So there will be some questions based on brain in this round. Okay? Rules for the round. Questions will be related to brain. 1 question per team. 10 marks for the correct answer. 5 marks for answering the pass. There is no negative marking. It will go from A to B. Okay? That's it. This time there is no negative marking. Very good. Identify the mark structure, Team A. Okay, there is a structure in this mark. You need to identify the structure. Team A.
Anterior commissure.
Team A says anterior commissure. What do you think? Correct. They get full 10 marks. This is the anterior commissure. And for the people sitting here, this is the corpus callosum. Now, a question for the audience. If you can see my marker, you just need to look at the mark and tell me what organ in the brain am I pointing at. Anybody from the audience wants to answer? Raise your hand. I can't see your hand. Okay, what was it that I wanted? Yes? Midbrain. Correct. He gets an audience prize. In this AIIMS in 2017, they asked a question. He seems to be very popular. Okay, in this AIIMS, they have asked a question. They put a pointer, 2017 AIIMS. They put a pointer here. Okay, they had put a pointer here at this area. And they asked what disease affects this area. This was this year's AIIMS paper. They put a pointer here, and there was something black here, and they asked what is the disease. Can you tell me? So answer was Parkinson's. Very good. That was how in this AIIMS exam they had asked the question. They marked the substantia nigra, and the answer was Parkinson's. This theme is called as integrated MCQs. Integrated MCQs means they point our anatomical structure, but they ask the disease associated with it. Okay? So that is how the theme is. I'm sure some of you are getting very emotional about the theme. Now, please, can you now tell me, okay, I'll give you a question. Anybody knows the answer has to raise their hands. Okay? This structure that I'm trying to put my dot through, okay, is the cavity of which embryological vesicle in the brain? What is this a cavity of? What is this and what is this a cavity of? What was that? What did I try to put mark for you? Aqueduct. But my question is, what is aqueduct a cavity of? Is it a cavity of prosencephalon, diencephalon, mesencephalon, rhombencephalon? What do you think? So she wants to answer. You already know, guys. You want to He says mesencephalon and he gets a prize. Yes. Aqueduct is the cavity of the mesencephalon. Third ventricle is the cavity of? Third ventricle is the cavity of diencephalon. Third ventricle is the cavity of the diencephalon. Lateral ventricles are the cavity of telencephalon. So that is how it goes in question. And anybody can identify this part. Not for prize, if you can tell me, what is this? Vermis, cerebellar vermis, because we are in the midline. Okay? And what is this? Fourth ventricle. Fourth ventricle. Okay? With this background, let's go on to the next question. Okay? Let's go. The blue are the veins, the red are the arteries. Okay? I'm being very helpful. In every exam, you will see examiners will always tell you that I am there to help you. Never trust them. Okay? Examiners are never there to help you, they are there to test you. Okay? Let's see. Team B. Looking at the image continuously will not tell you the answer. I am passing it. Pass Team C.
Inferior petroral sinus.
Inferior petroral sinus. Incorrect. Team D. Inferior sagittal sinus. No, incorrect. Team A. Team A. Should I go to the organs if you don't tell me?
Superior petroral sinus.
Incorrect. Team audience. What do you think? What do you think? Audience, what are you looking at? Yes. He says sigmoid sinus and he gets a prize from us. And he also seems to be very popular amongst the auto. Okay, I know you're getting excited, but he has to answer. Team C. Team C, what do you think?
Posterior inferior cerebellar artery.
This is posterior inferior cerebellar artery. He is correct. He gets 10 marks for this question. You need to look at the vessel that I'm going to point at. You need to tell me what is this blood vessel a branch of. Okay? What is this blood vessel a branch of? Raise your hand and answer. What is this blood vessel a branch of? Look at the blood vessel. Okay. Now tell me. Anybody? Yes. Sit down back. Okay, you don't get anything. Okay. So the girl at the back is. So both of you will share a prize. Okay. Both of you will get a prize. Okay. This is posterior communicating artery. Posterior communicating artery is a branch of internal carotid artery. Very commonly done mistake by people. That's why I asked you this question. And they both got it correct. With this, we move on to the next question, direct for the team D. Out of the following alphabets, you need to tell me which alphabet is corresponding to the cerebellar peduncle. Okay? Out of the easy question I am giving you. Direct anatomy questions. You are not taking them. Judge, what is the price for this? Price? 25,000 rupees are at stake in Australia. Hindi. They say A. Incorrect. Okay. I pass it to team A. C. This is C. Correct. You get 5 marks again. Correct. He says memory body. He gets a prize. Yes. Correct. That is memory bodies. Very good. Okay. Now, final audience question on this image before I go on. Okay. Which letter in this image is pointing towards the cerebral peduncles? Cerebral, not cerebral, cerebral peduncle. Where do you think is cerebral peduncle? Yes. He says I. And I get surprised. Yes, correct. The I is the crus cerebralis here. Okay? Very good. Very good. And the final, if you invite, nobody gets it. Okay? Everybody is answering, I'm not going to give it to you. Okay. So we move on. We move on. And these are the labeling that we talked about of chiasma and pyramid, and the D is the olive. Okay? Round 9 would be loudspeaker round. Team D, direct question. What is your diagnosis on this image? Typical question, very often asked in your exams. What is this? What is the diagnosis? I want to know the disease. Team D. You can't get this one wrong. Epiglottitis. Incorrect. We pass to the team C.
Laryngeal edema.
Laryngeal edema. Incorrect. We need to pass to the team B. I want to know the diagnosis, not the finding. What is it seen? I'm giving you a patient. Should we pass to the team A? Take your marks back. Team A.
Laryngomalacia.
They say laryngomalacia. Which prof are you in? Which prof are you in right now? 5 prof. Yes, A is very easy for you. Okay. Now, look at the CT image. This is the coronal CT section of the, some part of the body. I'm not telling you the body. You need to identify what is this. Okay? You need to identify what is this. Okay? Very difficult question. Today in the exam, the last exam, they even asked anatomy on paranasal sinuses, anatomy of pharynx, and on cross section also. Not only on anatomical images, cross section also. Let's see. Team C. What is it that my arrow is pointing at? Okay. We are not going to give it to you. Team B. Team B. Team B. Any idea? Team B? Want to play? I have a good audience question also on this. So please, look at the image for other structures also. The other structures will be given to you as an audience question. Team B. This is the blowout fracture. Did I ask them to diagnose the disease? I said identify structure. They did not listen to me carefully. I don't give you anything. Okay? Team A. Team A says it is a pass. Okay? Team B. It might come to the audience, I think. Brilliant, but it's wrong. My error is not at the management sinus. Okay? Team audience. Anybody who has not answered and not gotten a prize so far? Okay, check shirt. Yes. Okay, don't tell all this to other people, okay? Or anybody. Okay, the boy at the back, yes. Yes, okay. Any other cell in relation to that? It's not probably. Okay. I am not going to give it to you, this is Heller's cell. Now, look at this again. This is the inferior terminate, this is the. Compare it to middle terminates, what do you think? This one is pneumatized. So if you see pneumatized middle terminate, what is that called as? Very good, brilliant. You get a prize. Yes. Conca is the answer that I was looking for. Very good. Okay. So I feel this is the level that the exam would go at. For the people who do not understand, this is the coronal section of a CT scan looking through the paranasal sinuses. These are the frontal sinuses, these are the maxillary sinuses. This is the nasal septum. Inferior terminate, middle terminate, and this was the Heller cell. Okay, now we go on this. Now we go onwards. I'm sure you will be able to do PP. We say you are checking the stiffness of the tympanic membrane for which disease? Incorrect. Okay, T-A. What therapy are we doing? This is not diagnosis, we are doing some therapy for management of some condition. I want to know the condition. Team A. Pass. Team A says pass. Team D. Incorrect. Team C. Audience, get out.
Finally, it was masking of some.
No, I'm not going to do it. Okay. Audience, you want to win a prize? Yes. Meniere's disease and Meniere's disease. Correct, he gets a prize. Very good. So this is Meniere's disease. They say Weber, Ferguson, incision, form, maxillary. Correct, you get it correct. Very good. You may get full 10 marks for that. And swallowing difficulty, foul breath, crepitation, barium swallow shown to you. You need to give me diagnosis here. Okay. Very simple question, just to win a prize. I thought I should do something. Variance follow, shows are finding, forward breath, swallow difficulty, repetition is the lung, variance swallow, something is in the variance swallow, you need to tell me what is it. Last, yes. He says vectors, divertical of mind. Correct, he gets a prize. Sitting at the back of the class. Yes, very good. He gets a prize. This means I will show you a poster of some organization or some program. You need to identify the poster. You know, what subject are we inspired by? Yes, PA.
National Vector-Borne Disease Control.
They are correct. And I want you to know in the exam, you don't need to know this, okay? Don't worry, okay? What can you see here? Can you see the picture? Yes. So it's in the picture itself. This is the logo for National Vector-Borne Disease Control Program. And often they ask in the exam, that is the message that they do and schedule. So they will always ask the question, all the following diseases are included in National Vector-Borne Disease Control Program except. Classic MCQ. So you need to know them by heart, okay? So don't forget. Now what's your team B? I'm sure you can tell me. Team B. And this is one of the pattern in the today's exam. When they have started asking visuals, one or two questions on the logos have always been asked in PSM. They always ask one or two questions where they show a logo and you have to identify the organization or the program. Team B. They say it is iodized salt being made here. No, we are not going to give it to you. Team C. They say it's a pass program. No, okay. Incorrect. Team D says leprosy, and with the applause, we already know they're correct. I was in a mood not to give it to you, but the audience of audience are doing it. This is national law to how much? To bring it to 1 or less than 1 per 10,000 population is the goal of national leprosy eradication. Very, very important. Okay? With this program. Actually, in front of you, RITC. Okay, we give it to you. Revised National Tuberculosis Control. We'll tell you what are we looking at. Team D, identify the poster. What do you think? This is Beti Bachao. Pass it to team A. Team A.
ICDS.
Team A says ICDS. Can you tell me the full form? I'm giving it to you. 5 hours.
And child development.
Nutrition, immunization, something for the mother as well. Nutrition, health education for the woman as well. That's why the logo has the motherly child both. Very, very important. Okay. So it was a good round so far. Let's see if we have our audience. Okay. You can her. Yes, please. She's you're not raising her hand. Oh, we give it to him. Yes. UNICEF, correct. He gets a prize. He gets an audience. United Nations International Children's Services. These are main children. That was the clue that I wanted you to have. So this was a round based on posters. Still at 15 in B. 15. 40. 50. Team D is at 15. Smoke team seems to have a good advantage here. The round 11 is about character unveiling. What do I mean by this? In this round, the round is related to pharmacology. You have to unveil the drug from the hints. I will give you the hints, but I want to know the drug. 10 marks for the correct answer, 5 marks for answering the past question, no negative marking for the wrong answer are the rules to be followed in this round. Okay? You have to unveil the drug and tell me what drug are we talking about. Okay? On your mark is correct. Put 10 marks. Now, an audience question. What is the eye finding? And can you name any other disease in which we have a similar, other than amiodarone, similar appearance in ophthalmology can be seen in one more disease? Can you tell me? Anybody else? So no prize for you. Sit down. Okay, anybody? What other disease can have a similar appearance to this that we see in America? They say Wilson's disease, incorrect. Any other answers? Obesity. This is the roll-like appearance called as vortex neuropathy. It is also known to occur in Fabry's disease. That was the answer that I was giving. Fabry's disease, the question. So if they have correctly identified team A, they deserve a big hand for their performance so far. Team B. Team B. Direct question for you. You need to unveil the drug based on the picture shown to you. It's straightforward. Anticoagulant drug acts on RNA polymerase. Something shown. This is rifampicin. Correct. Now, audience, what do you see in this? What is this? Orange colored urine is the clue that I wanted you to see, and they have identified color rifampicin. Rifampicin is the answer, and that was the orange distribution of urine. I want to know why do we call it rifampicin? Why do you call rifampicin? Why? Because there is a movie by the name Riffy, and the discoverers were particularly movie buffs. So they called it after a movie. So that is where it is called. So probably it's the only drug which is named after a movie, rifampicin. But maybe you did not know this. It's okay. There was no prizes to do over here also. You go to TC. Antibiotic, which is a cell wall synthesis inhibitor, acts by inhibiting trans-glycolase enzyme. It has a narrow spectrum of action. An image is shown to you. Join the dots and unmeet the drug. It can't be simpler than this, Team C. Team C. You understand the question? Vancomycin? He's saying vancomycin. Correct. Now, before we're giving you marks. Before we, what step is it? MRSA is the where you use this drug. What do you talk about? Vancomycin, and this is red man syndrome for you. Why do we have red man syndrome? Is it because of rapid IV infusion of drug? Very important. When you give vancomycin, it's supposed to be given slowly. If you give it rapidly, this will lead to red man syndrome. That is the message that I wanted you to have. So with this background, Team D. Very simple question, You understand? The real exam, simple things you forget. Okay, that is my message to you. Okay, I can hear you.
Similarly,
He says symmetry, and I am sorry to not give the very marks. I pass it to Team A.
digoxin.
He said digoxin, and they are correct. Audience, what is this plant? What did I show you? What genus does it belong to? What is it? What is this plant? I want you to plant. Yes, we call it foxglove plant. This is foxglove plant of the genus Digitalis. This is the plant that I wanted you to see. But many of you could actually answer just by looking at sodium, potassium, ATPase, and the side effect. You could have actually done it. Now, next, in Rama radiology image. And I have taken all images from the recent exams only. Okay? They have all been asked in the real exam. And they will have to identify the anatomical structure of the image that I will show. Okay? Yes. So we will try to correlate another marked by A. Okay? And this was a question in this exam, recently exam as well. Okay? Identify the structure marked by A. Team A. Team A, tell me the A.
Right atrium.
They are saying right atrium, which is correct. This is the cross section of the thorax. A is marking towards the right atrium. They get full 10 marks. Very good. Audience, you want to take home some prizes? Okay. Identify the structure marked by the D. Marked by the D. D. This is not arch of yoga, my dear friend. This is a cardiac chamber seen posteriorly. What is that? Left atrium. Left atrium. Okay? Anybody can identify this structure that I am putting a dot at? Okay? I don't know. Very good. But which part of yoga is my question? All choices are yoga, not only. Arch, ascending, descending. What is that? Descending aorta. Descending aorta. Can you see how this is the heart? You can see the descending aorta here. You can see the esophagus here. This is the ascicus vein. This is the vertebral body, ribs, right atrium, part of the right ventricle here, left ventricle, arch of aorta, the root of aorta, aortic root. Okay. Now with this background, let's go to the team B. Team B. I'm sure you should be able to. Patience. Everybody is wiser than you're sitting in the audience, okay? He says it is adrenal gland. Oh my God. Wrong. Team C. Thymus. Correct. Full thymus. So this is not indifferent. You see, adrenal is located in the abdomen. This is thorax. These are the lungs. This is arch of aorta. Superior vena cava. Thymus. Okay? Don't get it wrong in the exam next time. Okay. So this is what happens sometimes when you've never seen a radiological image. You get confused. Team C. What do you think? I'm sure you should be able to get this. Anybody? You see, we're talking about senses, discussing the parts of the brain that you can see. I'm trying to confuse them. What do you think? You see? Everybody is waiting for your answer, my dear friends. Should I pass it on? I'm being very lenient to you. But don't take advantage of this. Please answer. Okay. Hepatic vein, hepatic artery, very bad. Okay, correct. TB. So I will not tell you that why this is not so easy. TB. Ascicus vein, incorrect. Team A.
Left common carotid.
This is left common carotid and they are correct. 5 marks. So why you were wrong is, my dear friend, this is not abdomen. Please look at these black things are the lungs. This is the mediastinum. This is the right brachiocephalic vein, left brachiocephalic vein, right brachiocephalic artery, left common carotid, which is the answer. This is the left subclavian. This is the esophagus. This is the kidney. This is a cross section from the mediastinum, where we are trying to look at the vessels, and this is the exam question. This has been asked in the exam. So that is why I have tried to choose the questions which are actually at the real exam level, so that it's nothing like, the real thing. Team D, direct question for you. So I'll change the question. You don't identify what is being marked, you just identify what is being marked now. Team D. Just ignore the arrow, look at my arrow and identify what it is. Okay? You want to see my arrow again? Team D, yes. And by mistake, not big mistake, but they did not take advantage of a mistake. Team D. Okay, 5, 4. Just being so guilty, I showed the answer. It's so good. Wrong. No marks for you. Team A.
Common bile.
Correct. Now before I move onwards, I want to know from the audience, anybody in the audience who wants to identify the investigation. Okay. Last one. Yes. ERCP. Is it wrong? Wrong. Now, anybody wants to answer? I know you know. Okay, you can answer. Yes. Which investigation is this? Yes. MRC. Very good. This is magnetic resonance cholangiopancreatography. We are looking at the biliary tract and the gallbladder using MRI. This is MRCP. And every year in the exam, one image of MRCP is there, then they ask anatomical structure. Let's see if the audience is able to pick it up. Can you pick up this thin thing here? Can you see this thin white line here? What is that? Pancreatic duct. That is the pancreatic duct. So that is why we say magnetic resonance cholangiopancreatography. Okay. Let's go onwards. That is at position 4 now. Team B, you are at position 4, but you can still make out. Okay? Position 3. Team B is at position 3. Team C. 55. Team is at number 2. And number 1, we all know, is the home team. So I'm sure whatever money they are going to earn is going to be well spent in treating the friends here. Surely, do you agree? They already are saying that 3 years. So now number 13 would be about on-screen chemistry. What do we mean by this? Now if I put 3 images together, now please can see, if I put 3 images together, Sri Devi, I don't know if you know her or not, who is he? Amreshwari, Anil Kapoor, what does it become? It becomes Mr. India. That means, I'll give you some clues, okay, in this round, I'll give you some clue, 10 minus, and plus 10 and 5 for the past time. We will start with team A. Polyosteotic fibrous dysplasia, cafe or large spots, pseudo-precocious puberty is the clue. You need to put them together and give me one syndrome. Team A, very simple. Polyosteotic fibrous dysplasia, cafe or large spots, pseudo-precocious puberty. What do you think, team A? Home team, yes.
Neurofibromatosis.
Neurofibromatosis is incorrect. Team B. They say pass. Team C. Audience, get ready now. It might come to you. You might get a prize.
McCann-Albright syndrome.
Sorry. Correct. McCann-Albright syndrome is the correct answer. Now, I want cafe-Ullmann spots of neurofibromatosis from McCann-Albright syndrome. Are you able to follow? How do we differentiate? Clinically, how do you differentiate? Have you heard of this before? This has been asked in AIDS exam in the past. Anybody now wants to answer? You understand the question? Both will have cafe-Ullmann spots. I want to know how do I differentiate between them? Anybody wants to answer? Okay, have you heard of this mnemonic or this statement given in a book called Coast of California? You know? Coast of Maine? You know it or not? No. Okay. So in which of these we have Coast of California? Neurofibromatosis. Because Coast of California is smooth. They will have smooth borders. While McCann-Albright, they will have wavy borders because Coast of Maine is wavy. So this is how we remember. Very important question, very often asked. I also want to point out to you, okay, very important question. Please look at the gene, GNAS1 gene. Okay. In our exams, there is now a new trend that in most of the central exams, they have a focus on gene which is causing a disease. You understand? That is called a genetic basis of disease. So they have asked a question, what is the gene mutation responsible for McCann-Albright syndrome? What is the answer? GNAS1 gene. Okay, mutation in the GNAS1 gene. That was the, and this was the point that I discussed. That McCann-Albright syndrome, the cafe-Ullmann spots will have rough borders called as Coast of Maine, while neurofibromatosis will have smooth border, Coast of California. How do we remember this? I tell you. How do I remember this? California, we have heard about. So it must be smooth. Maine, we've never heard about. It must be rough. Understand? So that is the way we need to remember this. Very important question. It is asked in the exams. Okay? Now with this background, we go on to team easier question with this. Short neck, low hairline, restriction of neck motion. You need to tell me the syndrome. Team B. They say Turner syndrome. Incorrect. We go on to team C. Team C. What do we call this triad? In this disease do we have this triad? Team C. Hold on. Team C. Yes. I can hear you. You're talking about the results only. Yeah, here for our police. We have to come to the audience also. Yes. I put down another question. Team D. The question is passed to you. Team D. Any prizes for the second team also? Any cash prize for this team who comes second? How much? 12,000 is at stake for the second also. Okay? Team D. Klinefelter syndrome is incorrect. Team A. This is pass. Audience. Okay, the girl here. Yes, please. Orange t-shirt. Yes, in the back. He says Klippel-Feil syndrome, and it is correct. He gets a prize. Correct. Step 1. This is again a question which is possible for you in the exam. Let me take you to the next image. In C. Direct question, very easy. Hold on. Gastrointestinal hematomatous polyps, mucocutaneous hyperpigmentation, increased risk of malignancies. So easy. This is the future exams. What is the gene? What is it? Germline defects in tumor suppressors, serine, thyroxine, kinase, orientation towards visuals. They have an orientation towards genetic basis of disease. That is the new pattern of exam. If you forget about it, you will get it wrong. And the third is, instead of asking anatomy, they ask radiological anatomy in new pattern exam. They ask images and they ask radiological images. These are the three things that I want to take on. This is all Proust syndrome. This is the image that they can ask you in the exam, where you can see mucocutaneous pigmentation. I will go on to the team B. Infections, eczema and bleeding. Anybody? TD, should I pass it? They're saying pass. B. Respiratory syndrome is not the answer. Team B. Pass. You see, visual language. This is Westcott-Eldridge syndrome, and that is correct. 5 marks. Correct. So you look bacterial infections, eczema, and bleeding, which is caused by thrombocytopenia. Which is correct. Very good. You got 5 marks. Direct question for the wrong answer. Really? 5 plus, 5 minus. Okay? So that we can change the fate in this round. 5 plus, 5 minus. Okay? 5 questions, 30 seconds maximum, no negative or unanswered. Okay? If you don't answer, there are no negative. Everybody understands? Okay? I am removing the projector from here. I think I am able to do it. Yes, I am able to do it. You have it here. The paper is it. Big hand for Arjun for putting so much hard work as well. So we come to the first set, and this is for.
Excuse me, sir. What is the questions related to?
Yes, I will repeat it. If there is time. If the timekeeper says time, I am happy to help you. Okay. I go to the first round for team A. Okay. First round of questions. Let me just see. And the time starts now. Vertebral opening of the esophagus, vertebral level. I want to know the diaphragmatic opening of esophagus at what vertebral level? A. Correct. What is the codon for cystine? Codon for cystine. UGA, correct. Viruke bodies are seen in phloem. Correct. Hepcidin is important for metabolism of which iron? Correct. Iron. Which section of IPC defines Greekius verb? 320. Correct. Take it all 5 correct. So these which year are you in right now? They are in junior final right now, my dear friends, and they are good. And you are in third final. Very good. Very good team effort, and they've been able to do all right. Okay? So now we go to the second team. 5 questions, 30 seconds. You can make or break the game here. Okay? And the time starts now. Effect of cholecystokinin on sphincter of OD is. Okay. Correct. Acute megakaryocytic leukemia is seen in which subtype of AML? Correct answer. Nagler's reaction, NAEGLER, is used for identification of which organism? Correct. Which is the most common blood vessel involving Takayasu arthritis? Wrong. So they could not get the. There was some clear is the most common artery involving Takayasu disease, and the question that they got right was cholecystokinin leads to relaxation of sphincter of OD. Acute megakaryocytic leukemia is M7, AML M7. They got it correct. I have one more question which I can give to the audience for the prize. Okay. And this is last year's central exam question. Let's see if you can answer it. Okay. This is a anatomy question. Are you here for it? Cervical part of esophagus is supplied by which artery? cervical part of the esophagus is supplied by which artery? Anybody? Okay, last one, please. He says inferior thyroid artery, which is correct. He gets a prize. Slightly on the tougher side, but this is how the exams are today. They ask a very tough question as well. Very good. Okay. Now we come to the final two sets of questions. This is for team C, and your time starts now. Gleason scoring is used in which malignancy? Correct. Inheritance pattern in sickle cell anemia. Correct. Nixon's method is used for clinical examination of which organ? Which section of IPC defines fertility? Pass. Mechanism of action of fluorofluorones. Wrong. Wrong. So any you want to answer anything again? Nixon's method is for fertility section. So they got 2 correct and 1 incorrect. So the answer that they got correct was Gleason's scoring is used for adenocarcinoma of prostate. Sickle cell anemia has autosomal recessive inheritance. Nixon's method, okay, that's the audience question now, is used in for clinical examination of which organ? Is given in Hutchison. He says 3. Correct. He gets a prize. It's a clinical examination method. Now the second question. Is it a method for palpation or something else? You have already got a prize with the other people. So Nixon's method is for anybody? You can tell. Percussion of speed. And that is what is given in Hutchison as well. Okay, don't panic. We are at the final most round and we are at the final most part of the quiz. Team D. Okay? I know you guys have been patient, and I think this time we need to give a big hand for the wonderful audience that we have in this auditorium. Beautiful audience. Very good. It's a pleasure to actually interact with people. Very good. Team 4. Team B. Set 4. Okay? Your time starts now. Which syndrome is characterized by congenital absence of pectoralis major? Hallman-Miller sign is seen in? Incorrect. HLA association with ankylosing spondylitis. Neurosteroid effective for absence seizure. Incorrect. Keith Wagner classification is used for? Okay, so they got 1 wrong and I think they got nothing correct. They did not get anything correct. 2 wrong. Okay, 2 wrong. So that's the risk of this round. So we go back to the audience and look for some prizes. Okay. Poland syndrome was the answer for the first question. I am sure you all get this pectoralis major and they could not get it. Hallman-Miller sign is seen in. Anybody from the back side wants to answer? Okay, you can answer. Yes. He says nasopharyngeal angiofibromatosis is correct. He gets a prize from the organizers. And I'm not going to ask you this question. Ankylosing spondylitis, I'm sure everybody knows this. Actually, T27, they should have answered, they did not get it. Keith Wagner classification is for. Okay, you're at the back, yes. She says hypertensive retinopathy. Correct, she has a prize. And the tough question in this set was neurosteroid effective for absence seizure is. Neurosteroid effective for absence seizure is. Anybody knows? Anybody? What do you know? And let me ask you to the other teams. Do you have any idea? Neurosteroid useful for absence seizures. You don't know? So he knows. He says Genoxlon. He gets a special prize. Correct. Very good. So that was a tough question. That was a tough question, and I'm happy that somebody is able to answer. Genoxlon is the answer. Now, with this, we come to the end of this quiz, and I'm happy that we have. I'll ask my team to quickly work up the final scores. By the time they work up the final scores, let us have some questions for the audience. Do we have prizes left? Do we have audience prizes? Do we have some chocolates for them? There are pen drives. Now, next question is for pen drive. Sure, pen drive. Okay. I want to win this one. Okay. Can you name the person who described the cause and what is happening in scurvy? Who told about scurvy? He says James Lind that he gets a pen drive. Correct. James Lind was the man who told us that the sailors were getting scorbutic syndrome and that is why. Okay. When we are talking about scurvy, I want to know from you, can you name a metal deficiency which will resemble scurvy in its clinical manifestations? Okay, the only one hand is up, yes. He says copper deficiency, which is also called a pseudo-scurvy, correct? Yes, a pen drive, very good. So copper deficiency is also called a pseudo-scurvy, that is the answer, correct, very good. Let us see if we can ask you some more interesting questions. Let's see if you can answer. Okay, let me ask you a question. Let me ask you a question here. Can you name a brain tumor, a classic brain tumor, which does not respect the midline of the brain? Classic brain tumor which crosses the midline, does not respect the midline. He says glioblastoma multifocal. This is correct. He gets the prize. Glioblastoma, he already has a pen drive, so we give him a Dams Harrison notebook. Can I see the notebook? Now, there is a set of books that we are actually giving as a prize here. This is Dams Harrison notebook. Do you see the size of the book? Yes. Do you feel it's doable? Yes. If I had shown you Harrison, you would not have felt the same. Have you seen Harrison before? Yes. What we have done is we've actually summarized Harrison in points. We've collected all important tables from Harrison, and we have even included the page numbers of Harrison that you should read. And actually another book here. And that is the vision that we have in Dams is to convert, and I see the last one here, to convert text into this is, can I see the other one, pathology. So this is our last book based on PSN. So what we've done is, we have converted past PSN into 2 points. So what is the difference between this and a guidebook? I'll ask my team to actually circulate it to you. What is the difference between this and a guidebook? This is pathology last book based on Robbins pathology. What is the difference between this and a guidebook? I'll tell you my theory. My theory is that in India, even in PMT, PG, whatever guide you are buying, it will only help you with questions which have been asked in the past. They will never help you with the questions which will come in the next exam. You agree here? You understand? Today in the pattern of our exams, they are asking very few repeat questions. Very few repeat. Everything is a new question. So why do toppers get it correct? I tell you. So what we do is, we look at a book like Robbins, we open the page, and we act like a student, and we convert each page into points. Understand? Instead of looking at what has been asked in the past and all, we create bulleted points on each page. This is what is Dams Pathology Mastery. And to win this book today, you need to answer the first line written in this book. Okay? And this is the first line written in Robbins Pathology also. Okay? Let's see if you can answer. Human genome contains roughly how many DNA base pairs? Okay, he wants to answer, yes. Can you tell me in simpler language? 3 million. Billion. I have to give it to you. 3.2 billion base pairs is what is written on. And you will be surprised. This is not given guidebooks, but this is the first line in the book, and this has been asked as an HTML exam. This is what we do at attendance. We ask questions from the books, and I'm asking to give you our promise. So, I have another question from the Robbins line from here. Let's see if we can answer. What percentage of the genome comprises of the protein encoding genes? What percentage is my question? Yes, you please, yes. This is 1.5%, this is correct. 1.5% of the genome is actually protein encoding genes, which is 20,000. So this is the kind of stuff that we do. And actually speaking, this is the difference between people who get a good rank and people who get an average rank. My suggestion to you is again, people who get an average rank only are able to answer these which have been asked in the past. You understand? They are not able to answer new questions. Why? Because they focus too much on the guidebooks which are written on the basis of questions asked in the past. And when the examiners they ask new questions, they struggle. So to answer new questions, you need to make notes like we have done here on the basis of textbook. Okay? Now I'll ask you a question here from, and I think the score is also there. There's a pen drive to be given. Name a disease. This is this year's JIP1 question. Name a disease caused by, and if you have attended my class, don't answer. Don't play. Okay? Notch 3 gene. Notch 3 gene mutation. Which disease is caused by Notch 3 gene mutation? 2017 JIP1 exam. You understand? What is the quality of exam being done today? Notch 3 gene. Name the disease. Anybody? Yes, he wants to answer, yes. No. Anybody can tell me? Notch 3 gene association. The answer is Cadastil. A disease called as Cadastil. C-A-T-A-S-I-L. Cerebral autosomal dominant arteriopathy with subcortical infarction and leukodystrophy. 2017 JIP1. Do you understand? So again, if I again take you back to the message that I actually wanted you to have through this quizzes, in the today's pattern of exam, you have visuals, new questions, applied anatomy, you understand? Applied anatomy and genetic basis of disease is a new hot thing today in the exams. And images on radiology and anatomy put together. Last year in NEET exam, there were at least 5-6 questions in each set based on radiological images and they had asked anatomy. Do they ask ECG in the exam? Yes, even ECG is again a very important topic for our exam. Visuals are the new buzzword for the exam. That is our message. And I hope you enjoyed the quiz. The quiz was more graphic, more visual. Just to make sure that you enjoyed, I feel the all 4 teams deserve a big hand for sitting in front of you and backing it out to win. And I'm sure you would want to be there next time. We have also initiated a quiz at DAM's website, quiz.damsdaily.com. You can actually log into that quiz, that is called as Grey Matter. You can fill up that quiz, answer the quiz, you will get an alert where you can register for it. It will be online quiz. If you come into top 8, we will sponsor your visit to Delhi, we will call you to Delhi, and you will sit and compete in front of a live audience. So that's a national quiz that we do all over India for a price of 50,000 rupees is the finalist that gets. So you can register for that quiz at quiz.damsdaily.com. And I again thank Dr. Amit, Dr. Jagat for taking this initiative for all Gujarat quiz. And I want to tell you that this quiz has been done in 4 zones. They have gone to each zone and they have all won the zonal rounds to come to you for the finals. And every one of them is a winner. Okay? At the end of the quiz, you don't lose. Everybody wins because you learn something. Okay? That is the message that I want you to have. I ask the team to come forward and give me the people who have come. We can go from the reverse. I invite the team from Surat, team for Surat to come up, and they are the 3rd runner-up of this final round. 3rd runner-up. Okay. I think the negative marking did you. Okay. Congratulations. Congratulations. And
This is Parth Bhargavia and Shivam Agrawal. Big round of applause for them.
And the second runner-up is the team from Bhavnagar. They have a total score of 55. They are a second runner-up from
Priyesh Parmar and Ruchit Patel.
After demonetization, everybody gets only a check prize. With GST included, we give them a prize of how much? 5,000? For each of them? Total. Oh, total. They are getting total 5,000. Any of your friends wants to take a prize or a party from them? You have. Congratulations. God bless. Team who is the first runner-up today is the team from Rajkot. They scored a total of 80 points. They are Priyank Chokshi and Harshil Khusagia. Please be here. Congratulations.
They get cash prize of 15,000 for the team. Congratulations. And
now we take the occasion, and I don't know who is the winner. We don't know which college are they from. We welcome the home team who have actually, and I want you to see the score. Team second has score of 80. And how much do you think they have scored?
yes.
200. What a points. TJ Medical College. Dr. Shiva Panchu and Akhil Kandhani. Congratulations. And from my side, if they are not in any of the course, please give them a free course as well.
Free course. Yeah. It is included.
And so not only they are getting a cash prize, they are also getting a free admission into a course in labs. How much is the course worth? 65,000 worth course they are getting free of cost. Perfect. And congratulations. We forgot to give them the real check as well. And we thank you all for your active participation, and it was lovely being in your auditorium. It's one of the best auditorium. I want to thank the auditorium team as well for helping us so much to help us to do this event. And the audio system rocks, the visuals rocks, you guys rock. We are happy to be here. Thank you very much. We wish you all the best. Thank you. And the winners also get a copy of my book. I have written a small book called as Fire in the Penny, and they all get a signed copy by me for complimentary from me. Thank you. We can do a quick audience photograph as well, please.